my name is Shaylee Marshall, and today I'm going to show you how to perform a wound culture collection. Before I begin, I'm going to perform all my general principles and safety practices. I'm going to knock on my patient's door, introduce myself to the patient, and ask the patient to identify themselves using 2 patient identifiers, like their name and date of birth. I'm going to check their bracelet, make sure that matches. I'm going to assess the patient for any allergies, make sure all that matches with their MAR. Before moving on with this procedure, I would ask the patient if they are in any pain and need any pain-reducing medications. If they were, I would administer those pain medications using my 11 rights of medication and doing my 3 checks. After I give them that medication, I would come back and reevaluate their response and then continue with my procedure. Now I'm going to perform some hand hygiene and put on some clean gloves. I'm then going to expose the patient's wound and put my trash bag out. Okay, I'm going to start by taking off the old bandage. I'm going to use the push-pull method to take off the tape or any transparent dressing from around the wound, starting from the outer edges, working my way into the center, and I would use saline to moisten it if necessary. I'm going to note the type of drainage, the amount of drainage, the color of it, and if there's any odor from the drainage. Then I'm going to dispose of that in the trash. I'm going to take off my gloves and perform some more hand hygiene, and then don another pair of clean gloves. Now I'm going to clean the wound. I'm going to use a preservative-free saline to do this, and these gauze are already pre-moistened with that saline. I'm going to use a clean gauze for each swipe, starting from top to bottom. And then I'm going to dry it using different gauze each time. I'm going to pat that dry. Okay, once that's done, I'm going to take off my gloves, perform some more hand hygiene, and don another pair of clean gloves. Now I'm going to collect my wound culture sample. I'm going to open this and take off the sterile cap, making sure I'm not contaminating the swab. I'm going to touch it into viable wound tissue, making sure I'm not coming into contact with any of the wound's intact skin around the edges. Making sure I'm not contaminating the swab, I'm going to place that into the tube. And then I'm going to take off my gloves, perform my hand hygiene, and I would label this tube with the date and time according to facility policy, and I would send that down to the lab.